Hello friends, this is our second part of inflammation. In T video we will be discussing about acute inflammation. In previous video, which is first part of inflammation, is contained definition, causes, signs and types of inflammation. Link is given in description. Let's start acute inflammation. It can be divided into following two components. 1. Vascular event. 2. Cellular event. So now vascular event contain two types of alterations included. 1. Haemodynamic changes. 2. Altered vascular permeability. Now under haemodynamic changes, there are 5 changes occurs. That is, 1. Transient vasoconstriction of arterioles. 2. Persistent progressive vasodilatation. 3. Elevation of local hydrostatic pressure. 4. Slowing or status of microcirculation. 5. Leukocytic margination. This was about haemodynamic changes. Further move on altered vascular permeability. There are Starling hypothesis which contained 1. Outward movement. 2. Inward movement. Now cellular event can be discussed under 2 heading. 1. Education of leukocytes. 2. Phagocytosis. Now we are detailing more about vascular event. In vascular event, if any tissue injury occurs in human body, then human body responds to that injury, and that earliest response is alteration in microvasculature. So that alteration are including 2 changes. First are haemodynamic changes. In this, immediate vascular response is of transient vasoconstriction of arterioles. With mild form of injury, the blood flow may be re-established in 3 to 4 seconds, while with more severe injury the vasoconstriction may last for about 5 minutes. Then occurs persistent progressive vasodilatation of arterioles. This change occurs within half hour of injury. It results in increased blood volume in injured area, which is responsible for redness, that is one of sign of inflammation. After that, elevation of local hydrostatic pressure, due to increased blood volume. This result in transudation of fluid in extracellular space. This responsible for swelling, and after that, there is slowing or stasis of microcirculation occur, which causes increased concentration of red cells. Now, we move on altered vascular permeability. Already discussed above in vascular event, that there are appearance of inflammatory cells and increased vascular permeability, which is responsible for exudate appearance, means inflammatory edema. This is well understood by Starling's hypothesis. According to this, normally the fluid balance is maintained by 2 opposing sets of forces. 1. Outward movement. 2. Inward movement. However, in inflamed tissue, intravascular colloidal pressure decreases and osmotic pressure of the interstitial fluid increase, resulting in excessive outward flow of fluid into the interstitial compartment, which is exudative inflammatory edema. Summary. Till now, we are done with vascular events. In this, haemodynamic changes shows the sign of inflammation, that is redness, warmth and pain, and altered vascular permeability. There is edema, that is also sign of inflammation. In part 3 of inflammation we will be discussion about cellular event. Please do subscribe our channel.